We, the jury, find the defendant Beverly, employee of Ashford General Hospital, guilty of breaching Public Law 104-191, the Health Insurance Portability and Accountability Act, known as HIPAA, for compromising patient confidentiality and protected health information. It is based on sound current practice that protected health information should not be used or disclosed when it is not necessary to satisfy a particular purpose or carry out a function. The minimum necessary standard requires covered entities to evaluate their practices and enhance safeguards as needed to limit unnecessary or inappropriate access and disclosure of protected health information. The privacy rule protects all individually identifiable health information held or transmitted by a covered entity or its business associate in any form, whether it is electronic, paper, or oral. The privacy rules requirements for minimum necessary are designed to be sufficiently flexible to accommodate the various circumstances of any covered entity. Most people consider their medical information to be personal, sensitive, and private information that is strictly between the patient and the doctors, only to be used for the benefit of medical treatment. Unfortunately, this is far from reality. Many people who have nothing to do with patient treatment have access and use of medical information. The proper protocol for healthcare staff when leaving a phone message for a patient to discuss any health information or treatment is to leave your name, the organization's name, and a phone number for the patient to return your call. According to Ashford's Hospital, all employees are trained to review registration information for patient contact directives regarding leaving messages. The plaintiff, Jacob Jones, gave specific instructions to be contacted at his work number and not at his home number, which Beverly failed to follow those guidelines. In the future, to avoid situations where a patient's health information is in danger of being exposed to unreliable sources, Ashford Hospital must establish policies and procedures that comply with federal and state laws and regulations regarding protected health information. Healthcare staff must be trained on the policies and procedures with respect to protected health information while maintaining appropriate documentation to demonstrate compliance with federal and state privacy law and regulations. Also ensuring that any health information that is disclosed is in compliance with the privacy rule. Ashford Hospital must monitor compliance and implement corrective action where and when it is needed. Non-covered entities that have access to individually identifiable health information are encouraged to disclose the minimum necessary, exhibiting the importance of privacy and confidentiality of patients. Patients must be assured that the health information they share with healthcare professionals will remain confidential. So, with all information being put before the court, we, the jury, recommend that the defendant, Beverly of Ashford General Hospital, be punished. Under the U.S. Department of Justice, there is clarification of who can be held criminally liable under HIPAA. Cover entities and specified individuals who knowingly obtain or disclose individually identifiable health information are in violation of the Administrative Simplification Regulations and face a fine of up to $50,000 as well as imprisonment up to 1 year. We, the jury, are in favor of the plaintiff.